Systemic lupus erythematosus, or simply SLE, is an autoimmune disorder leading to inflammation and tissue damage in multiple organ systems. It is not a disease of a single system. It is an idiopathic chronic inflammatory disease having various type of predispositions like genetic predisposition. Monozygotic twins have a greater chance of having SLE as compared to normal population. Environmental factors that can act as triggers sometimes include sun exposure and drugs. Hormonal factors include estrogen, that it is more common in women. 90% of cases include women of childbearing age of women 20 to 30 years as compared to men. There is an hypothesis that the pathophysiology of SLE includes defects in apoptosis or in the clearance of apoptotic cells, causing inappropriate exposure of intracellular antigens on cell surface, leading to deactivation of B and T cells and the resultant production of autoantibodies, immune complex deposition, complement activation, and vasculitis, resulting in the end tissue damage. It has few clinical features on different systems. Now remember, it is a multi-system disease. The most important one is the cutaneous manifestations, which includes the malar rash, the butterfly rash, the discoid rash, which are actually the raised keratotic lesions, and third is the photosensitivity in result to the exposure to sunlight. These cutaneous manifestations are very prominent. Musculoskeletal features include arthritis, which are non-erosive and have symmetrical polyarthritis involvement. GI features include oral or nasopharyngeal ulcers. There is the serositis features in the pulmonary and cardiac systems. In pulmonary system, it causes the pleuritis and pleural effusion, and in cardiac, it causes the pericarditis. In the blood, there is hemolytic anemia noted with lymphopenia and thrombocytopenia. These three features could be not be present at the same time. Immunologic features include anti-ANA antibodies, the simply ANA bodies, anti-Smith antibodies, and anti-phospholipid antibodies. Neurologic features include seizures or psychosis, and renal features include either nephrotic syndrome, that is proteinuria of 0.5 gram per day, or IPC cast, that is hematuria in the urine, that is a feature of glomerulonephritis. All these clinical features and the investigations, that is the serological markers, are acting as the diagnostic criteria. Out of 11 diagnostic features, if 4 are present, it is diagnosed as SLE. The investigation are same, including the immunological features like ANA, double-stranded DNA antibodies, anti-Smith antibodies, anti-phospholipid antibodies, anti-Rho and anti-LA antibodies. The management include, first of all, the prevention, that is the patient should avoid exposure to the sun. The patient should use SPF, that is sun protecting factor 25-50. Depending upon different manifestation of the disease, in case of mild to moderate disease, NSAIDs, oral glucocorticoids, should be used for the treatment of general constitutional systemic features. They decrease the pain and inflammation. Hydroxychloroquine is specifically used for the arthritis features. In case of a severe and life-threatening disease, methylprednisolone IV in a pulsed manner is given to the patient. Methotrexate and azathioprine like immunosuppressants are used to decrease the antibody production. Cyclophosphamide specifically can be given in case of glomerulonephritis. Cyclophosphamide is a very toxic drug, so another drug called mesna is used which protects against its toxicity, or mycophenolate mofetanil can be used in its place. Rituximab, a monoclonal antibody, is also used in some cases. The maintenance therapy includes oral prednisolone, immunosuppressants like azathioprine, and methotrexate. If a patient is having any comorbidity like any cardiac disease, in that case hyperlipidemia and hypertension should be controlled. If he has positive antiphospholipid antibodies, lifelong warfarin therapy is given sometimes. SLE patients are more prone to osteoporosis, so regular DEXA scanning should be done to evaluate the bone density.